USA Tonight's Health Beat, brought to you by Riopan.
The doctor who reviewed Chancellor Richard Green's medical chart today after Dr. Green's death says that Green had trouble breathing all day yesterday, and had he sought treatment, he might have lived. Green had long suffered with asthma, as does Police Commissioner Ben Ward, and 1 in 20 Americans, 9 million people in all. Although asthma can be controlled with medication, the death toll among asthma sufferers is rising of late. 5,000 people dying last year. Kristi Witker has more.
People with a genetic weakness in their lungs are most prone to develop asthma. When a person has asthma, 3 things happen. The bronchial tubes become inflamed and swell. Mucus is produced, further clogging the airways. And then, during an attack, the bronchial tubes constrict, making it difficult to breathe. Dr. Arthur Lubitz, a New York allergist and asthma specialist, says in a very severe asthma attack, such as the one suffered by Chancellor Green, the lungs become so blocked that the patient can't breathe at all. If he doesn't get emergency medical help in time, oxygen is cut off from the heart and brain, and the result is cardiac arrest. He says the death rate from asthma has risen 25% in the past 5 years.
The death rate from asthma is going up for several reasons. One, people go to many doctors instead of going to one doctor that they trust. And 2, they use the emergency rooms as their primary doctor. Third of all, there's increased pollution in the urban environments, and that appears to play some role. Fourth, people today have a much tenser lifestyle, and therefore that's leading to increased incidence of asthma. And fifth, and not least, they're suffering severe allergies, increasing amounts of allergies to all substances, and their lungs are overreacting.
What about the situation with Dr. Green? Do you think his coming to New York affected his asthma?
I would imagine that the stress of running New York City schools certainly didn't help his asthma. And then New York City has a different environment than Minnesota, where he comes from. We have more grass pollens and less tree pollens than Minnesota, and this week the grasses start to pollinate.
Dr. Lubitz believes many asthmatics don't take their condition seriously enough. They rely on bronchial dilators, which help keep the airways open, but do not reduce inflammation. Instead, they should be trying to forestall attacks by reducing the irritants that aggravate asthma. The best advice is not to take your lungs for granted. If you're an asthma patient, it's a good